Nurses who study the right courses that are in demand or specialize in the right field benefit from employment opportunities with more responsibility and autonomy, higher levels of compensation, and opportunities for career advancement. This video will take us through 10 best nursing courses or specialties for a nursing career that will provide fulfilling work experiences and competitive salaries. Number 10 on our list is a surgical nurse. Surgical care practitioners provide treatment in operating rooms, wards, and clinics. They are trained to perform certain surgical procedures under appropriate supervision and within the scope of their practice. Their primary responsibilities include assisting surgeons and other professionals before, during, and after surgical procedures. Within healthcare organizations, surgical care practitioners are well-established members of the surgery team. The 9th specialty is a geriatric nurse. Geriatric nurses look after elderly patients and ensure their quality of life is the best it can be. They are registered nurses who serve as primary and specialty healthcare providers under a physician. They are able to diagnose and manage their patients' often long-term and debilitating conditions and provide regular assessments to patients' family members. These nursing specialists work in a variety of settings, from nursing homes with home health care services and in hospice facilities or running their own private practice. In recent years, the demand for geriatric nurses has expanded. The 8th specialty is infection control or prevention nurse. Nurses who are in the field of infection control and prevention identify, surveil, and manage infections, diseases, and viruses. They are typically registered nurses who have filled a critical role during the COVID-19 pandemic as healthcare systems needed specialized workers to focus on patient case reporting and widespread infection prevention. They work at hospitals, clinics, and community health centers. The 7th specialty is a trauma nurse. While working in emergency rooms, critical care units, or as part of an emergency medical response team, trauma nurses help take care of patients in critical, unstable, and life-threatening conditions. They administer wound care, emergency medications, and IV fluids or blood transfusions, operate life-saving equipment such as defibrillators, and monitor vital signs. Trauma nurses receive specialized training to work with physicians and to stabilize and treat traumatized patients. The 6th specialty is a psychiatric nurse. They assess, diagnose, and treat patients with mental disorders. Psychiatric mental health nurses offer services to people who have mood disorders, phobias, depression, or dementia, as well as those struggling with substance abuse or other addictions. In addition to administering medication and therapy, their duties include crisis intervention, mental health assessment and evaluation, and patient assistance. Psychiatric nurse practitioners provide consultation and care to patients suffering with mental health, behavioral health, and psychiatric disorders. With a growing population suffering from mental and emotional health issues, there is a demand for psychiatric nurse practitioners. Before we move on, if you are new to this channel, welcome to Pat's Tune. Be sure to subscribe if you are interested in videos that are educative, informative, and entertaining. The 5th specialty is Anesthetist nurse. They administer anesthesia and pain medication, observe vital signs, make adjustments, and monitor patients during surgical procedures and in recovery. Anesthetist nurses work with patients of all ages in scheduled surgical operations or emergency procedures. They can work in hospitals, physicians' offices, rural areas, and the military. They can also work in a non-clinical setting. The fourth specialty is a public health nurse. They provide education on health and safety issues among families and communities and assist them with access to health care. They identify health concerns and prioritize safety issues within communities, prepare and implement safety plans, and serve as healthcare advocates. Instead of waiting for patients to come to them, they travel over sometimes very difficult terrain to actively serve their communities to help improve the health of the population. The third specialty is a research nurse. Nurse researchers are scientists who study various aspects of health, illness, and healthcare. By designing and implementing scientific studies, they look for ways to improve health, healthcare services, and healthcare outcomes. They often write articles and research reports for nursing, medical, and other professional journals and publications. These highly specialized nursing professionals conduct scientific studies, analyze data, and report their findings about illnesses and improving healthcare. They focus on topics that impact the field of nursing and save people's lives. The second specialty is a midwife nurse. They are nurses who specialize in pregnancy, prenatal care, childbirth, and postpartum recovery. They primarily focus on pregnancy care and also offer general services for women, including gynecological, reproductive, and preventative health care. Midwives care for patients from labor through delivery and provide postpartum assistance. They often serve as primary caregivers for women and their newborns. Employment for midwives is expected to grow by 11% through 2030, according to the Bureau of Labor Statistics, making this a good specialty to pursue in nursing. Another lucrative specialty is neonatal nurse. They work in intensive care units that care for infants at risk of complications and in need of specialized care. These include premature newborns and those born with cardiac or other birth defects, genetic conditions, or drug dependency. Neonatal nurses typically care for these infants until they leave the hospital, but in some cases will provide care beyond the newborn phase. Which of these nursing specialties or courses do you think is the best and more lucrative? Tell us in the comment section. And as always, don't forget to like and subscribe.